My pleasure to now yield 5 minutes to the gentlelady from Pennsylvania, Congresswoman Dean.
I thank you, Madam Chair, for hosting this important hearing, and I thank you, Director Carvajal, for your work. I was happy to hear last April before a Senate Judiciary Committee that BOP was working to expand mental health treatment and vocational training and life skills. I also hope that BOP is expanding substance use disorder treatment, recovery, therapy, and the rest. One thing I have in mind in particular are educational opportunities. We know they make all the difference in helping to break this cycle of recidivism and reincarceration, which is why I introduced Elijah Cummings' the PrEP Act, legislation that would ensure that incarcerated individuals receive educational opportunities they need to successfully re-enter their communities, re-enter their lives after completing their sentences. Can you give us an information on the number of people today enrolled in your system in educational opportunities?
Yes, Congresswoman. The information, the current information is we have over 75,000 inmates enrolled in one of our 80 evidence-based recidivism reducing programs or productive activities. Even since COVID, although we were hindered by the pandemic and we had to slow things down, over 151,000 inmates completed programming. Of course, the literacy programs, the GED, we offer many trades. We have over 200 career technical educations. We've done a lot of work with expanding programs specifically for the female offenders. We have dedicated staff just to make sure that we process that population's special and unique needs. We are working with the Department of Labor to expand apprenticeship programs because we know that vocational trades help people get jobs when they go out.
And some of the things that the PrEP Act would do would be higher education. College credits. What percentage of inmates are enrolled in educational programming?
Congresswoman, I don't have the exact numbers off my head, but I'll certainly follow up. I'm sure we can get you that information.
Okay, terrific. If you would share that with the committee, that would be great. What programs are in place regarding addiction and substance use disorder? What percentage of inmates struggle with either mental health or addiction? And how many are being offered treatment?
Congresswoman, we have many drug abuse programs available. We have our residential drug abuse program that is one of our best evidence-based programs. We also, under the First Step Act, we expanded our MAT treatments. That targets a specific subset for the opioid people with opioid use disorder, and we currently work on expanding those treatments. I don't know the exact percentage. It is a high amount of people that come into our system with drug and alcohol abuse programs. I don't have the exact percentages, but we can certainly get them to you.
I would really appreciate it if we could get the percentages, and also to understand if treatment is universally available throughout the system. We know that there is a high correlation of addiction, substance use disorder, and incarceration. On to solitary confinement in the few minutes that I have left. We read reports, we hear from inmates and their families on the dangerous side effects of solitary confinement, the serious lasting psychological damage, contrary to the very set of questions I just asked you. Pre-pandemic, it was conservatively estimated that 60,000 to 80,000 people were confined to solitary, and we understand that solitary may have been used as a substitute during COVID for isolation, medically required isolation. Can you give us an update on the use of solitary confinement? And importantly, I hope on a recognition that it is a failed practice.
Yes, Congresswoman, we average around 9,000 inmates at any given time in our restrictive housing units. About 8,000 of those are for administrative purposes, pending placements, conducting investigations. Sometimes there's separations for their own safety. There was 1,100 in there pending disciplinary action. We try to make that, we try to use alternative sanctions, and we try to limit the time that someone spends in restrictive housing. One of the things that we've done to address this issue, for just some of the reasons you stated, is that we've expanded our what we call a reintegration housing unit program, which allows that group of inmates who tend to spend time in restrictive housing, a general population type atmosphere, a smaller general population, so that we can remove them from restrictive housing. So that is something that we monitor daily. We're committed to ensuring that everyone in there has access to programming. They do, medical and everything else. We also ensure that we make rounds daily and check on the inmates. They have constant inmate contact.
Director, I thank you for your questions, your answers, and I look forward to the information coming to the committee, and I yield back.